Well, I listened to Obama's speech tonight. Actually, it took me about 2.5 hours to get through that. I took the time to actually listen to it and I took about 10 pages worth of notes during that speech. And I'm not going to wait for the TV pundits or anybody else out there to give me any input on this, because I kind of figure, I have some intelligence left to be able to interpret certain signs and signals here. So this is going to be a multi-part video, probably. I could make it a very long video if you like, but I should warn you right now, if you're not interested in some sort of an analysis, you should probably tune out right now and not even waste your time, okay? Because you're probably going to hear it on television afterwards and by various TV pundits. I'm not a TV pundit, I'm just a regular person. And so here it goes. So he started out by saying, after his introductions, which took place at Georgetown University, and I might say the introduction itself was actually sort of faked, because the sitting in the audience were not the students he was supposedly addressing. It was mainly a much older audience, and probably fairly vetted and invited to that entire venue. But okay, let's forget about all that. So he basically started out by saying that everything is on the table, including non-discretionary spending. So that actually means, when he says that, that actually means Social Security, Medicare, Medicaid, and the defense budget, which he stated makes up 2/3 of the entire U.S. budget, which is basically true. Okay? So then he goes on to say, to their credit, and he's crediting the House Republicans for bringing up some proposal. He says that basically they want to reduce the deficit by $4 trillion over the next 10 years. And then he sort of enumerates on that, reacting to their proposal, okay? And he explains it, and he says that this would lead to a very different kind of America. I totally agree. So I have no quarrel with that. So he starts out by saying, they're cutting 75% of clean energy subsidies. They want to cut 25% in education funds, and they want to cut 30% in transportation funds. So this is, the Ryan proposal that he's actually talking about. He didn't mention it by name, but that was the crux of it. Then he goes on to say that basically every Medicare patient in the future, according to that proposal by Ryan, would have to pay $6,400 more per year for their medical care while they're on Medicare in the future. And that figure has actually been backed up by the General Accounting Office. So yeah, that is probably a pretty good estimate, So he's right in saying in his speech that this basically would mean that there is no more guaranteed health care of any kind for senior citizens or the poor. And it essentially privatizes Medicare. That's what it's doing. So he did point that out. And he's right in pointing that out. And he also adds, that that's going to create 50 million more American citizens uninsured, or basically underinsured. They can't afford their medical care, on top of the 45 million people that we already have in this country who have no medical insurance whatsoever. So, yeah. And, he points out that basically, nursing home care for the elderly who now receive Medicaid, or disabled children, that would simply just go away. And these people would essentially have to fend for themselves under this Ryan budget. He's also right about that, because that's exactly what it would do. Now, I'm just going over my notes here. But, at the same time, while he's talking about these Medicare cuts, in this very paragraph of his speech, he's not really starting to talk about the Bush tax cuts yet. That comes later in the speech. And he then launches into his own program a little bit later, his proposal. And what he says right up front is that the Cat Food Commission, it's called the Cat Food Commission, this commission that he created, was basically a far more reasonable proposal than, Ryan's proposal in Congress. So this means that he has essentially already accepted the recommendations of this commission without any public debate, what their recommendations even are, okay? And we're just supposed to take it on faith that, somehow this is a pragmatic vision. Now, you have to remember that this entire commission, deficit commission that Obama created, was composed of the captains of industry. And, it wasn't even really bipartisan. We had a lot of CEOs and very wealthy people on that commission. And there was only one representative for labor, and only one representative to speak up for consumers on that entire commission. So this is his starting point in terms of negotiations here, with in opposition to this Ryan proposal. So you see, once again, the spectrum is being moved on further and further to the right. But, let me go over it point by point, and like I said, I made some notes. He's, in his first point, while he pointed out in his previous paragraph in his speech, he pointed out that, totally discretionary spending, such as energy, spending, jobs, education, funding, and so on, that's all discretionary spending, and it's a smaller part of the budget. And he went on to say that maybe, if we cut any of these programs, it really won't make much difference anyway. Okay, so that was his argument. Then, of course, he goes on to say that he supports job training programs. He supports clean energy. And he supports all this while recognizing that at the same time that it's only a minute thing in the entire federal budget. And he doesn't go into details whatsoever here. Okay, he just says he supports this kind of thing. He supports that spending, which I also support. But then he goes on to point 2, which means, savings in the defense budget. That was the second point. So he's not talking about cuts, mind you, in the defense budget. He's talking about savings. And his solution to the problem is to have Gates, Secretary of Defense, Gates make some recommendations, appoint some other commissions in order to see how we can save more money in the defense budget. There's no mention of the word cut anywhere. Okay, so this is the kind of commission that's going to take another 2 or 3 years to make their recommendations, and then I suppose we'll see what happens after that. So there are no blanket defense cuts, not to mention that there was nothing mentioned about our ongoing wars, drawing those down, and getting our country out of these foreign wars and out of this mess. There was absolutely no word mentioned about it during the speech. Then he launches into his third point, which he said, let's reduce healthcare spending in our budget. That was the word he used. Reduce. And the word reduce doesn't exactly mean savings. The word he mentioned before in the defense budget, by the way. So then he says our differences, the differences between House Republicans and my own budget is very clear on this point. And basically he then proposes that his budget will reduce the cost of healthcare itself. So now Obama wants to reduce the healthcare itself by how? So here's what he's actually proposing. He's proposing wasteful subsidies. He is proposing erroneous payments as opposed to private insurance companies. And then he's proposing the purchasing power of Medicare in order to bring down the cost of drugs. As some of you may have noticed, this is precisely what he was saying in his, in his budget for healthcare, in his proposal for healthcare reform, and that didn't happen. It went exactly the opposite way, because basically he gave the big insurance industry and big pharma even more control over healthcare costs. So that's my critique. It's funneling more money into the healthcare system without really any oversight by Medicare, least of all, to begin with. But that's what he says should happen. And, I just don't know how at this point. If he wouldn't have caved in on single payer national health care, then that might actually be a point of discussion. Maybe we could actually reduce those costs. But without that, and with the pharma lobby, the insurance company lobby, and the doctors' lobbies, how do you think you're going to bring down healthcare costs realistically? Then, point 3, this also had to do with healthcare going on. He's demanding more of the governors of all states, regardless of party, he says, to demand more efficiencies in Medicaid. Now you have to remember, Medicaid is the program for the very, very poor and disabled children. Okay, so he's proposing more efficiencies, but it's going to be basically shoved off to the states. You see, it's the governors now who are responsible for this. Well, presumably there are some cuts going to be made on the federal level with no more matching funds. And he said this thing about it's just, it sounds good, okay? It sounds good. So what he said was that we need to we need to have incentives for doctors and hospitals to get into preventive care. This is while mentioning Medicare, by the way, Medicare, so that this doesn't happen in the future. Well, sure. I mean, who would not agree with that? But we're talking about Medicare. We're talking about people who are already poor, already disabled, people in nursing homes, for whom prevention is a little bit too late at this point. And people simply, listening to the speech, they're not going to make that connection. Sure, it's a great future plan, but it's not going to help those people who'd rely on these programs right now and for the next generation, basically. Then he says he wants to appoint an independent commission. I suppose that's just like the cat food commission then, of doctors, nurses, medical experts, and consumers. He doesn't mention, what percentage of these people, what the experts are. Who's defined as an expert? Some CEO by an insurance company, maybe he's the expert, or she's the expert. Never any details, okay? Never any details. And he says that to this commission then will reduce unnecessary medical spending while protecting access to care. You know what access to care in the private medical insurance industry looks like? You'll always have access to care. That's not the problem. But if you can't afford to pay those premiums, which is basically, the crux of the problem, yeah, sure, you'll have access to care, only you can't afford it. And this is, of course, the entire crux of this ridiculous Paul Ryan budget, which basically throws seniors and the disabled completely under the bus. So instead of attacking this kind of crazy proposal up front and vehemently, once again, Obama uses very kind words, very conciliatory words, so that those proposals can now be taken seriously, I suppose. And independent commissions, I'm going to skip a lot of my notes here, but he basically, the big statements here, this is a completely emotional appeal. You have to understand that speeches are designed to apply to your emotions. They're supposed to steer your emotions. Any good speaker, knows that. And so basically he said, I will not tell parents with children with disabilities that they now have to fend for themselves. But the whole thing is short on detail, once again. How is he going to prevent that from happening? He can tell them all he wants. And again, he says both parties need to work on strengthening Social Security, but without putting the current retirees at risk. Now, what about the future retirees? What about those people? Once again, the word reform is mentioned, but privatization obviously is not entirely off the table for President Obama. He did say that he didn't want Social Security to be at the whims of the stock market, but he also didn't leave out explicitly the possibility that it could be partially privatized. So, you kind of have to read between the lines here. And yeah, I think I'm going to make this a 2-part video. It's getting a little bit long, so you can, watch it when I upload it. It might be tonight or it might be tomorrow night. Thanks for listening and getting this far. Good night.